Hi, I'm Dr. Barron with Highpoint Spine and Joint Center, your Western Nebraska chiropractor. Again, I was making some videos about tennis elbow, and I want to give you a few things that you can do on your own to help with tennis elbow. So, like I mentioned in the previous video, tennis elbow is also known as lateral epicondylitis and is characterized by pain on the lateral or the outside of the elbow where all of these forearm muscles attach up into the lateral epicondyle. So it's usually involves repetitive motion disorders. So one of the best things that you can do on your own is really try to rest it. So the less stress that we can put on that tissue, the better off we are to try and let it to heal up. Also, obviously, with inflammation, sometimes over-the-counter medications, anti-inflammatories can help with that, and so that can be beneficial, just again using those as short-term relief. There are a few stretches that you can do. One of them is just to try and stretch out all the extensor muscles on the outside of your forearm. So trying to bring down your wrist to try and stretch some of these extensor muscles just a little bit. It's usually a little bit more helpful if you can get against a wall and extend your neck, rotate your neck opposite, extend your shoulder, and then extend and then flex that wrist and try to stretch it that way. A lot of times you'll feel a little bit more of a pull through the entire fascia of that arm, and that can help with this stretching a little bit. Another thing is ice. So just putting some ice, it's again an inflammatory response, so if we can put ice on it, that can help decrease inflammation. If you just want to put ice on it, you're going to have to leave it there a little longer, maybe 15-20 minutes. I'm kind of a fan of using a small cup. This one's plastic, but I would recommend a paper cup that you fill it up with water, put it in the freezer, take it out, and then peel the top off so you have some exposed ice. And then it's a good idea just to use that cup and right on the skin to massage and ice that area where it's painful. You can help strip out some of the ligament and the tendon tissue, as well as ice it at the same time. Using ice directly in that fashion helps the cold penetrate deeper. It can help a little bit better as far as an anti-inflammatory effect. There's also braces that you can use. Again, they work just because this is a repetitive motion disorder, and so if we can take pressure off of that tissue, we can help it heal up a little faster. This isn't something that I like people to wear all the time, but while you're working, you may wear it just to take pressure off of it. If you're not working, we like blood flow to get in there, and so having some sort of a brace that's restrictive can hinder that. So while you're active, you can wear a tennis elbow brace. It's just a brace that goes right around the arm here. It's not meant to go over the painful areas. It's meant to go below that to where these muscles, when you use your hand and when you use your wrist, that those muscles can fulcrum around the brace rather than around this painful inflamed tissue. So it's something that you want to wear an inch or so below the painful area on your elbow so that it just takes pressure and stress off of that area. Hopefully this is helpful. If you have any questions, feel free to contact me.